Hello and welcome to the SecurityMetrics podcast. Super excited to have you here with me today. And I keep getting told that I need to actually say more about the podcast before I launch into it. I'm Jen Stone. I'm a principal security analyst at SecurityMetrics. The idea behind our podcast is to help people who are maybe a little less technical, but even people who are technical. It's kind of runs the gamut of security and compliance, which is the space that we do a lot of work in. Today, though, so excited. I have with me Donna Grindle from Help Me with HIPAA podcast and Cardin. She and her co-host David Sims over at the Help Me with HIPAA podcast are just second to none when it comes to understanding HIPAA and breaking it down in ways that people can understand and why it's important. So I was so excited. Donna, thank you for coming and joining me today. I know that I missed a ton of things in my very quick hello introduction.
Oh, you did great. You did great.
What? Tell us about yourself, about your podcast, about Cardin. I would love to hear a little bit about you.
Well, I was born in the mountains of North Georgia.
Yes, you were.
Yeah. No, the Help Me with HIPAA podcast, David and I started that in 2015.
Oh, wow.
Before everybody knew what a podcast was.
Right.
And it's his fault, and he keeps taking credit for nagging me to do it. But
is it credit or is it blame at this point? I mean,
it's a little bit of both.
Okay.
Because I have to, share with David a few things. We have a running gag about all of our different things. But what you hear on the podcast, that's like a normal conversation. We just start recording it.
Nice.
And nothing special. But my background is, I always like to say I started when I had a pacifier in my mouth as a programmer back in the 80s, because I couldn't possibly be as old
me neither.
as I am. But yes, I started writing electronic claims software in the late 80s.
Wow.
Yeah, so I've been around healthcare IT for a long time.
Nice.
Yeah, I got to see, the transitions and people that have been around healthcare for a long time. They'll remember the blue form, which is the, at that time it was the HIPAA 1500. I mean, I go way back.
Okay.
And but in 99, I went out on my own, started doing consulting, and because I have a background in data, when they did the code set standards in HIPAA, I got all excited,
right?
Because now I get to do, because I was in the transition from proprietary to NSF to ANSI to, HL7, all of that kind of stuff. I still get nerdy with it. But then I got involved in the privacy and security part, trying to get people to listen.
Right.
And back then, the question was, what's going to happen if I don't do it? And I'm like, pretty much nothing.
Yeah. Trying to get people to do something without any consequences. That's a tough row.
Well, and and that's the problem with HIPAA, and that's why it has the name. Everybody's like, "Oh, HIPAA is just a." Well, no, because it's just been so confusing for so long. You have to do it, but you don't have to do it. And over time, I just got to doing more and more and more of it. And when the high tech stuff came out and the stimulus bill, I was like, I don't know, because I know how bad this is.
Right.
Everybody's going to have to start doing this stuff that they haven't been doing. They're going to fight it. There's going to be all these problems. I don't think I want to do this. And I went to a business coach and said, I want to figure out something new. And he asked me a bunch of questions, and he said, let me get this right. You are uniquely qualified to handle privacy and security in healthcare. And there's about to be a big need for it that you are uniquely qualified to handle. And you don't want to do it. And I'm like,
yep.
Glad I paid you a bunch of money.
Yeah. Thanks for setting me straight.
Yes. So I started by teaching IT companies how to do it, because I thought that'd be a great thing, because we were running an MSP at the time. And then I realized I don't care if you can't print, and we ditched the MSP.
Right.
And since for a while now, we focused on nothing but this since 2012.
That's some pretty awesome skill and experience to bring to this world, because no matter what organization I work with, they can be tiny, they can be a big hospital complex, they can be business associates, and honestly, most of mine are business associates,
Mhm.
because I'm super comfortable with that technology world. Where
Yeah.
the healthcare world, I don't have all the experience that you have. I have some. I do. I have worked for some different healthcare organizations over the years, but not to be coding, as it comes
Yeah.
along.
Yeah.
That's
It's
that,
it's a
and
unique perspective, that's for sure.
yeah, yeah, and I have colleagues who are better at the working with the healthcare providers than I am.
Mhm.
You have to know a lot about how their businesses run in order to
Yes.
be really successful in helping them get to a security stance and privacy in HIPAA.
Right.
That kind of brings up a question. There's a strong relationship between privacy and security in HIPAA, but a lot of
Mhm.
groups they just don't get what that means. You wanna speak to that a little bit?
Well, it's one of the things that we deal with a lot with business associates. Now, granted, we do a ton of covered entities that we don't focus on the big health systems. We're on the private entities. We do some small health plans, that kind of stuff, but mostly practices of some sort
Mhm,
or some type of entity like that. In our business associate business, where we work with MSPs, we work with software companies because nerd.
yeah.
And so we do some other business associates, but it is a common problem that they think all they have to worry about is the security rule.
Right.
But the issue is if you don't understand the privacy rule, then you don't understand what you're securing in the security rule.
Exactly.
And one of the big problems is, if something comes out on paper, it's still PHI.
Mhm.
You got to worry about that paper just like you have to worry about what's in the computer. If somebody's saying something, you have to worry about what they're saying, just like you have to worry about what's in the computer. And often people don't necessarily get that. So when I say, do you train your staff on minimum uses and disclosures? They're like, yeah, okay. Well, how do they understand what that is if they don't understand what everything in PHI is?
Right. So, one of the things that I try to explain to people is that security doesn't mean anything unless you're protecting something. And
Exactly.
like, that there's the
Yeah,
privacy has to be enforced by the security. But if you don't
exactly.
get the privacy part, then you're secure. What are you securing? You
Yeah,
know?
everybody doesn't get the privacy rule defines what PHI is and what
Yes.
you can do with it.
Mhm.
And the security rule kind of needs that
Yes.
in
Otherwise,
order to, yeah,
yeah.
yeah.
Otherwise, how do you apply it? Yeah. Exactly.
So, yeah, when we do an assessment of a business associate, uh, we've got our breach. No, well, we don't have to do that.
Yeah. Yeah. I
Have you
hear that all
read
the
your
time
business
too.
associate agreement?
Yeah.
Here's your privacy rule assessment. Well, we
Mhm.
don't have to do that.
Yeah.
How do you know you're doing the right thing on your, step one, a complete and thorough risk analysis requires you to know number one,
Yeah.
what is PHI and where is it?
Well, my favorite thing is if they start arguing too much, I'm like, let's open up the language of the law. And then I start reading through the HIPAA regulations with them, which is the most boring thing I do. Can't stand it.
Hmm.
They hate it even worse. But I'll point out
Hmm.
things like if you are a covered entity, the words covered entity are right there. If you're a business associate, the words business associate are right there, and it's all the way through all of the regulations. I'm like, "You can read this. You can find this yourself. I
Yeah.
promise you it's there." And so we
That's
we
like
all
when the
get there together.
omnibus final rule came out and I read all of it,
Yeah.
you know, but I don't get bored. I get excited. I've got
S
highlighted versions with links to things.
Donna, you really are a nerd.
I am. I'm a HIPAA nerd.
I try to be excited about, but I start reading that law and I just am like, oh, okay, we're reading this again. All right, this is good for you. It's like eating your
You know what's
broccoli.
good though? If you read the omnibus final rule, you get to read the discussions
Yeah.
about what people said
Hmm.
and their reasoning behind the way that it's written.
Yes.
And that is how I'm able, if you understand why things are done a certain way,
Mhm.
it's a whole lot easier to do it
Right.
that way. And security is security. It doesn't matter whether you're healthcare or not.
Exactly.
The difference is PHI.
You have to know what you're protecting first, and that's what makes HIPAA different. That and there's a lot of security standards that people try to follow that don't start with that risk assessment. But if you don't do the risk assessment, then it's a good exercise to know what are you protecting and where is it possibly vulnerable, and
Mhm.
it gives people kind of a focus to start with.
Yeah.
But I think some of our the people that I work with, and I don't know if you've seen this as well, but they kind of get confused about it because first of all, it's a lot of work, and a lot of work is expensive and it's time consuming, and organizations are just like, oh, I'm not sure how to take this on. But
Yeah.
also they get sometimes these groups that'll tell them, oh, hey, HIPAA made simple. So
You
tell
listen to
me,
my podcast, you know how that makes my eyes poke out.
how simple is HIPAA?
Well, what we always say is you don't know what you don't know.
Yeah.
And if you think it's easy, go ahead. And if
Hmm.
you want it automated, go ahead. But if you want to do the right thing and worry about taking care of your business
Hmm.
and your patients and your staff, because that's really what we're doing.
Right.
And you look at today what we're going through with coronavirus,
Hmm.
which I haven't had a haircut since February.
And I'm in my shed.
Yeah, at least this is my normal work environment. We have been a virtual company, no brick and mortar, over 20 years now. So,
Wow.
yeah, back in the day, I was like, I ain't getting an office. And then started the company.
Hmm.
And now people that work for me, they're like, until they
It's the
realize I
best.
want to see you on video. Damn it, I had a
Well,
shower.
so
Uh,
so yeah, but the coronavirus came along, changed a lot of
yeah.
things for a lot of people.
Well, the problem is it showed that we weren't ready
Hmm.
because privacy and security is a huge piece of being able to deploy during a business continuity need.
Exactly.
And business continuity is, when you ask people, do you have a disaster recovery business continuity plan, incident response plan?
Hmm.
Well, so and so knows how to do the assessment on a breach. We'll mail out the letters, like they say, and our IT company takes care of the backup.
Yeah, so a lot of them are saying, hey, maybe I should have really understood what emergency mode meant because we are all currently in emergency mode.
Uh huh.
Maybe I should have tested my contingency plan because
Hmm.
if you, I mean, this is a massive test for everyone. If they haven't tested it before,
Yeah.
it's being tested now. And the hard part is how do you, how do you, how do you get the resources and the people and the interactions that have to happen to set things up when
Yeah.
you're not allowed to go anywhere, when you're not allowed to interact at all?
Well, that's one of the reasons that we think folks that are the IT people are frontline people too,
Yeah.
and part of the heroes because in like 0 time, they brought the entire country to virtual.
Right.
I mean, just overnight.
Yeah.
And no one realizes that if they haven't been doing their jobs and continue to do their jobs,
Hmm.
yeah, there's been security problems, but it's because there's this, overall, when you think about the transition, this has been remarkable.
Yes. Yes.
And particularly in healthcare, when you're not in the business of dealing with the virus, your dermatology, your ophthalmology, any of these other things, they're finding ways to treat patients.
Yes.
And we spent the way we're competitors, you and I, but not really. That we do things so
I'm
differently,
okay if we
and
are.
we do things. Our approach is what some people call what is it? A boutique approach,
Yeah.
but we become like part of the team.
Yes, and
And
that is very different from how we do things. We'll take it to a point, but then helping implement that is a
yeah,
unique skill set all its own.
and we do that part. So we'll do the assessment. We come in and then say, okay, now you've got to do all this stuff. And really, we built our programs because people cried when we left, and I
Yeah.
felt bad. And so then other people, I don't look good in orange. And so we would build whatever it is they needed. And then more, and then literally, we had people break down into tears
Yeah.
over this in the beginning. And now we have clients that we've worked with for so long, and we have some that are in the hot spots down in Southwest Georgia. Southwest Georgia is a huge hot spot that no one's talking about.
I didn't
It's
know
a
that.
major problem down there
Mm,
because just as things were, there was 2 funerals in the Albany, Georgia area of people that were big names in the community.
mhm.
Everybody went, and so did the virus.
Oh, no.
And we're talking a lot have it's really impacted Southwest Georgia.
Mm,
It's very upsetting to know, and even in the HIPAA world, we lost Steve Lazarus last week, and he's a big name in the HIPAA world. And he had a great sense of humor, and I love watching him speak. And it took him.
mm.
But when we're talking with our clients down there, they started talking to us in February because we're like plan, 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 plan,
Right. Yeah.
plan, plan, plan. They're on the phone with us. They're worried about I mean, we're coordinating all kinds of things, helping them figure out how to manage, when it expanded and they needed to put a tent outside to
Mm,
triage patients to decide what door to send them in,
right.
and those kinds of things. And they call us and they say, I need a tent. What do I need to worry about with privacy in the tent?
Yeah.
But they're thinking about those things.
Sure. Yeah.
What walls do you put on the tent?
Mhm.
How do I manage the information? What if I've got multiple people in the tent?
Mhm.
These are things you have to worry about.
Yeah.
You should worry about because you're taking the time to plan it. If we're in a true crisis like the Pulse nightclub shooting, you don't have that time.
Right. Right.
But even then, people blamed HIPAA. I
For not
can't tell you. I can't tell you things because,
Yeah.
and
Well,
I'm
HIP is an
screaming
easy
at the
thing to
TV.
blame because people don't understand it well enough to push back on that.
Well, yeah, I've always talked about educating the public.
Mhm.
But I have a hard enough time educating healthcare,
Yeah.
and
Yeah.
I just went on a rant we recorded it. I don't know when it is either coming out or just we do 2 weeks in advance, and I can't keep up with what's been released or what I've already ranted about, and it's been
Right.
but there was an article in, I believe the Boston Herald,
Mhm.
and it was HIPAA's not designed for a pandemic, and I'm like, "Okay, let me check this out."
Um, I would disagree.
Yeah,
Uh,
it's absolutely got it all built in.
yeah.
I mean, everything they've done is built into the law.
Sure.
It's geared to be able to adapt. That's
Yeah.
why it's lasted as long as it has.
And not only that, there is a flexibility that we've seen come out from the OCR over at HHS
Right.
guidance on how to deal with
Yeah.
telehealth, for example.
Yeah.
Uh, there are it does adapt and it does flow with the situation, and I think that the whole idea of the contingency planning um, aspect of it is uniquely geared to something like a pandemic.
Absolutely. I I agree.
All right, then.
But
We are in agreement.
but turns out the article was about it even mentioned, and this is when I went, "Oh, this is what they think." The article was, they mentioned that a reporter who interviewed Tom Hanks and Rita Wilson came down with coronavirus, but they disclosed. They didn't accept HIPAA. They disclosed. I'm like, HIPAA doesn't apply to people.
Yeah. Yes.
And that's what the
reporter
article
was not a covered
saying.
entity.
Yeah.
So,
And that's what the article was saying, is you need to opt out. And it was telling everybody, opt out of HIPAA, opt out.
there is no
No,
opt out. It is a
no,
law. There is
no,
no
but
opting out.
it doesn't even matter. The point you were making is false.
Yes.
The premise and I rarely comment on anything.
Mm-hmm.
I had to comment on that.
Jumped in.
You know, I had to go in and say, you got this all wrong.
Yeah.
You know, but it is a big part of educating the public.
Yeah.
And I've done some seminars and stuff, and people's eyes are like,
yeah.
Really?
Oh, you have that the training that you and David do. It'll come to me in a second here. The boot camp. Yeah, the HIPPA Bootcamp.
The HIPPA Bootcamp.
Excuse me. The HIPPA Bootcamp. Which sounds like a great training opportunity.
Yes,
people.
we had one scheduled in March, which obviously,
yeah, it's not going on. Yeah,
that's not happening. We've moved it to August with hopes that'll work. So we have it, and you can get information at thehippabootcamp.com, registration, all that kind of stuff. It's August 18th, 19th, 20th here in Atlanta or Tucker, Georgia.
All right.
Which would be clear, and right down the street here.
And I think it's a great opportunity because a lot of people learn best in person.
Well, and the way we do this, you're fully immersed. We call it boot camp for a reason. Yeah. So we're doing it's 3 days. And we honestly say, look, we will not be able to cover everything in 3 days. You will be exhausted. But we're going to do our best to get you educated on all of privacy and security.
Right.
At least enough to understand what you're supposed to do, so that if you have to support clients that are supposed to do it, like the MSPs, we have a lot of MSPs that come to the boot camp.
Oh, okay, great.
And you have to do it yourself if you're a business associate. If you're an MSP, you have to do it yourself, and you have to have your clients do it.
Right.
And knowing where that line is and making sure that your clients understand that line. Yes, I have disaster recovery. IT takes care of the backup. You go to the IT guys.
But do they really?
Do you do disaster recovery? No, we only do the backup.
Also, restoring backups is not the same thing as disaster recovery. There's a huge gap between those two concepts.
Yeah, and I love what David says. Oh crap, he's gonna hear that. I love what David says.
Don't praise him.
I know. You can't do that often because his head is like the big marshmallow in Ghostbusters anyway. But he points out, you don't buy backup, you buy restore.
Yes.
And a lot of people forget that in their planning. And we go on, and those are some of the things that we do in the boot camp. And that's really and truly, it's run. We don't have like this session starts here and this. We're going to do these sessions between here and here, and we just go.
Yeah.
And periodically we stop because I have to go to the bathroom or something. We feed you while we're working. Occasionally we'll take a break just to walk around. But even then, we're talking about what we're doing. And
I think it would amaze people to know that 3 solid days of HIPAA education is not enough to cover it all. There is a lot to.
No, we can't hit HIPAA. It all. And we keep trying to figure out how to add more to it without adding more to it. But the way we finally have it is the first 2 days is, we start with, here is understanding the law and seeing the big picture. And, you always have the people that come in and we show them like the graph and, okay, down here is the technical part. So if you think IT's handling all of HIPAA, they're handling this
that little
right
part
here.
of it. Yeah. And
But
also they can't handle it well if you don't define for them what it is that they're protecting.
oh, yeah, I love it when I teach IT providers when they go into a new client that's healthcare,
Mhm.
you should ask for their risk analysis and their risk management plan. They
Uh-huh.
should have that. You should ask what's in their policies and procedures so that you make sure you're doing that,
And that's a
or
rough
they
one because a
change them.
lot of IT folk do not want to read other people's documentation. They don't even
No,
wanna read their own.
they don't wanna
So
write their own.
no,
I want
no.
yeah, and I had a tech guy, he was a developer, and I was explaining to him, when you put these security pieces in, I need you to document them.
Yeah,
And I was explaining to him, "Look, you make these decisions already. I
yeah.
just want you to write them
Just
down."
write it down. Just write it down.
And he
Does not have to
goes
be fancy.
and he stopped just as like in the middle of grumbling, and he goes, "You want me to eat my broccoli?"
Yes.
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 Yes, I do.
That is exactly right. That whole education piece and follow-up piece that you do that's that's some difficult work, because
Yeah.
you're spanning a lot of disciplines in order to get it all working together. Um, there's I think one of my favorite groups that I worked with so far started off as not my favorite group. They were they were a business
Ah,
associate over in India. So just
mm,
imagine being a HIPAA business associate that is not located in the United States and
yeah,
what it would take in
mhm,
order to become HIPAA compliant. And they absolutely failed the first year.
mhm,
And I walked away saying, well,
yes,
I feel bad, but they're never coming back. And yet, everything that I told them, they took to heart where the data has to be stored and what the security controls had to be in place in order for them um, to become compliant with
right,
this regulation. That how do we do what we want to do and and be trusted, right? So they knew that in
mhm,
order to be a trusted business associate for covered entities, if the covered entity knows anything, they're going to ask them, "Have you had a third party assessment?"
mhm,
So I personally find a lot of value in third party assessments
mhm,
because it's hard to look it's hard to look at what you're doing and find the problems because you're
right,
embedded in it. Like you live it.
mhm.
You're like, we're doing the best we can to put out this product. But then a third party comes in and sees all of the what's your experience with organizations and coming in as a third party the very first time they have a third party look at what they've got going on? What have you seen?
My favorite quote ever is we got a call and we're about halfway through because I mean we literally try to turn over every rock, just like you're talking about.
Yeah.
And being in healthcare, you totally get this.
Mm.
But they said, I've been through so many assessments, and going through your assessment is like a colonoscopy without anesthesia. I,
Accurate.
I said, yeah, we're doing our job.
Yeah. You're welcome.
She jokes and said, "You broke me, but I'm better now. I'm a better
Yes.
person
Yeah.
because, and the level that you have to get to truly understand the things that you constantly need to worry about this stuff."
Right. So from your standpoint, just to kind of wrap up these concepts, if an organization knows HIPAA applies to them and thinks they're doing all the right things,
Mhm.
what's the best thing that they can do to get a gut check on that?
I always say the first thing you have to do is say you don't know what you don't know,
Mhm.
because we've had groups that call us in and say, "We've got this covered." But, we take approach, it's fun at an expo when you're talking with people and we say, "Look, when it comes to HIPAA, most people fall into one of 3 categories. Is they think they have it covered, and if you do, we'll come in and just do we model the OCR audit protocol,
Mhm. Yes, that's
and
how
we
we
do
do as well.
audits.
Mhm.
and we'll do the audit. And we literally, it's like you sign up and then you just will randomly get the notification. I mean, we give you the upload place. We do it exactly the way OCR does it. We
Right.
just, we randomly choose the questions out of the protocol. So we'll do that. And if you think you got it covered, we'll start there.
Right.
Then there's the people that are terrified, and we're designed to build that program and help you build and manage the program. That's our wheelhouse. And then you have the people that say, HIPAA schmippa, I don't care. I can't really help you there.
Can't help them. Mm-mm.
I can't help you at that point until you're ready to reconsider.
Right.
And then I'll help move you to, I'm terrified, I need help.
Right.
Because that's the next step. It's not like you go from here to here.
Yeah.
There's 3. So the most important thing that you can do is step back. And even if you do it yourself, you can go and download that audit protocol.
Mm-hmm.
It's a big, long spreadsheet. There's hundreds of questions in there.
Yes.
And there, and one question is really like 10 questions.
Because it infers a lot of connections and a lot of things that have to be in place in order
Mhm.
to answer that question.
Yeah. Inquire if they have done this,
Yes.
but this should include this, 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 and this.
Mm-hmm.
And if you truly think you've got it covered and you don't want that third party input,
Mm-hmm.
at least go do that.
Yeah. Yeah.
And
Find out.
do the security rule first.
Yeah.
Just start there.
Absolutely.
And then make your decisions.
Good
But-
advice.
Or you could just listen to podcasts like yours and ours and go, crap, I don't know what's going on.
I'm not kidding you. I have listened to every podcast you put out.
Oh, wow.
Since I went back to the beginning and I listened to all of them because I think that you have a unique way of a couple things you talk about, current event, what's going on and how is it applied to things that I already know, but also how do you talk to people? And
Mhm.
I love the way you talk to organizations, both on the IT side and the non-technical side, about tough concepts. You have the language to do that. So I really value what you put out, and I'm
Thank
so
you.
grateful to you for joining me today. This has been something that I've really looked forward to.
Well, thank you very much. We appreciate that, we just record that and slap it out there and hope people learn from it. That's our big thing is we were all about educating people when we started.
Definitely.
And that's really what we're still about. And we love to get feedback that says it's working. And especially, when people are enthusiastic about HIPAA, because, we've had people tell us, I didn't even think my job mattered until I started listening to you guys.
And then it does.
And you really start to
100%
understand how much what privacy and security means in the world of healthcare.
Exactly. Well, I'm
And
going to
you
keep
do it
listening
too.
to you. I'm going to keep listening to you. I really appreciate what you've done. Thank you so much for joining me today, and I hope we get to talk again.
Oh, thank you for having me, and good luck with your podcast.
Thank you. All right, you take care. Thank you for joining us again here at the SecurityMetrics podcast, and I'll see you on the slopes. Thanks for watching. To watch more episodes of SecurityMetrics podcast, click on the box on the left. If you prefer to listen to this podcast, it's available on all your favorite podcast platforms. See you on the slopes.